So good afternoon, everybody. Thank you to join us and to be available for us and for our floor to speak about what are the innovations during this pandemic time in Africa and around the world. I would like you to tell us a little bit who you are and what are your specialty exactly. I think we can start with you, Dr. Ola Brown. Can you hear us?
Yes, I can.
Dr. Ola Brown, so you are the managing director of Flying Doctors based in Nigeria. Can you just quickly introduce yourself for us, please?
My name is Dr. Ola Brown, and I'm the founder of the Flying Doctors Investment Company. And we're an end-to-end healthcare company who we invest across the healthcare value chain. And currently we have investments in telemedicine, in retail pharmacy, in logistics, in air ambulance, and in life sciences as well.
Okay, thank you. I think we will go deeper through this panel. Mr. Israel Bimpe from Global Health Partnerships Lead, can you introduce yourself? You are in Rwanda.
Yes, I am. I am in Rwanda. I'm Rwandan and I work for a US-based company called Zipline. I'm in charge of global health partnerships at Zipline, mostly working with multilaterals and UN agencies. But Zipline pretty much uses drones and runs two of the world's first drone delivery services at national scale in Rwanda and Ghana, and in the US to be able to distribute PPEs to fight the coronavirus pandemic. But we've been present in Rwanda since 2016 and in Ghana since 2019.
Thank you so much. And then we have Dr. Chibi, Moredreck Chibi, from whose regional office for Africa in Brazzaville. Can you introduce yourself, sir, please?
Thank you very much. Good afternoon to you as well. My name is Dr. Moredreck Chibi. I'm in charge of innovation program here at the WHO for Africa. Basically, my job is to keep the innovation agenda a top priority, not only for my organization, but also for the rest of the continent, leveraging technological innovation and non-technological innovation to make health more accessible, more affordable, as well as of good quality. And as you know, that innovation is a track record of being a key driver to some of the breakthroughs, not only in the health sector, by the way, but in all development sectors. So the same trend is projected to rise as we are seeing emergence of disruptive technologies with transformative impact like artificial intelligence, stem cell research, big data, you can mention. So this is the domain that I'm trying to push, especially from our African brothers to take advantage and run with.
And I think that this specific period of pandemic is a good occasion to see exactly how innovations are really increasing on the continent. We have been all able to see on social networks different creations, innovations from around all the regions on the continent. Please, Mrs. Brown, Dr. Brown, can you tell us how this situation of innovation around COVID has been impacted in Nigeria, for example?
So in terms of, so I'll talk about it in terms of healthcare innovation, and I'll talk about it in terms of our overall economy in Nigeria. So in terms of our overall economy in Nigeria, we've seen a slowdown. The main source of Nigeria's income is oil, and the oil price has gone down because nobody's using oil for anything, because nobody's traveling. So in terms of our overall economy in Nigeria, we've seen a slowdown. But in terms of healthcare innovation, we've actually seen a bit of an uptick where for the first time really in Nigeria's history, as long as I can remember it, healthcare has actually had to take center stage. And we've seen a few more investments in healthcare. We've seen our central bank start a healthcare funds to give funding, debt-based funding to entrepreneurs operating in the healthcare space. And we've seen a lot of expansion in what we're able to do as healthcare providers. So my company, the Flying Doctors Investment Company, immediately started looking at solutions that we could offer. So we built, along with a business group that I belong to, YPO, we built the first 70-bed isolation center, which was completely crowdfunded. And it's still operational. We've discharged about 100 patients already, and that was a private sector initiative by the YPO group, and we supplied most of the critical care, or some of the critical care equipment for that, as well as the plan and design. We installed a molecular lab for testing in one of the Nigerian states, and then we actually designed and created a booth for testing to save money on PPE and to decrease the number of healthcare worker infections that were happening in the process of sample taking as well. And then we developed that booth into a mobile testing vehicle with the same system of external gloves, so that the healthcare worker and the patient don't come in contact with each other. And also they don't have to keep on changing their PPE. So actually both the booth and the vehicle by themselves in about 5 days, because of the savings that they make on the PPE side. And the booths, because of our investments in telemedicine, can also be converted after COVID to telemedicine booths where people can come for consultations.
This is really interesting, an interesting initiative. Israel Bimpe, how can you tell us exactly how these opportunities to innovate on health during this pandemic period was delivered in Rwanda, for example, through Zipline?
Yeah, I'll speak about it from a perspective of Rwanda and Ghana. You know, Zipline had opened services in Rwanda since 2016 and services in Ghana since April 2019. And pretty much our services is to be able to deliver medical products to anyone, regardless of where they are. So we can overcome hard terrains, you know, difficult products that are very difficult to stock at health facilities. We increase access to rare type of medical products and so on and so forth. And so when this pandemic really hit, there was, you know, implementing policies that limit how, you know, people can move around. And that underscored for us why it was really important to be able to respond as fast as possible. Because when you limit movement, that means that first you still need to distribute PPEs as fast as possible and ration them as much as possible. So you cannot, you know, give every hospital 100 PPEs if you only have 200 of them, right? So you need to give, you know, 50 where they're exactly needed so that they can mount a response very fast as PPEs continue coming in country as the international supply was being opened. And then in Rwanda, what we realized is that, you know, healthcare was also being affected. Some patients were not able to go to cancer special treatment centers to receive their medical products. And so there was a need to also allow those patients to receive care where it's needed. And the last point is that we realized that in Ghana, especially when COVID was spreading in rural areas, there was difficulties in being able to conduct testing, contact tracing, and so on and so forth. And testing was starting to be a huge blocker for those other activities to respond to COVID to be able to be implemented. And so hospitals started driving to Zipline, and the authorities in Ghana were really fast to allow Zipline to fly in cities. And so we've been delivering test samples from rural health facilities to the two biggest laboratories in Accra and Kumasi. And that's, you know, allowing 1,000 health facilities to still be able to conduct tests to be very efficient with tests so that it can unlock a much more efficient response with contact tracing, isolation, treatment, and so on and so forth. And so, you know, and this has accelerated during this pandemic. As I told you, other countries that have been slow movers on this have been, you know, approaching Zipline on like, how fast can you launch, and how can you go forward so that we could be able to launch. Lucky enough, we are a US-based company, so we're able to launch very fast in the US this week. But we are also hoping to launch in other African countries before the end of the year in at least 2 or 3 countries.
These are very interesting innovations, Dr. Chibi. How your organization is trying to support or trying to work with such innovations, and what are the major obstacles your organization are facing in working with kind of innovations and creativity?
Yeah, quite interesting. I was listening to both presenters. Yes, this is exactly what we are trying to promote here at WHO. So starting with the situation for innovation for COVID, if you had asked me this question, say a month ago, I could have given you like a look home kind of response. But definitely my answer is pretty much different now, as I have somewhat a clear picture of what is happening on the continent. And WHO in the African region, we launched a webinar series actually just recently, just to some of the breakthrough innovations that that are emerging from our continent and that are already being deployed for COVID response. And I'm actually happy to say Dr. Ola Brown's mobile testing technology was also invited for Spotlight event. And also now from the number of applications that we are receiving from all over the continent to have this opportunity to showcase these innovations, it's amazing to note the kind of talent and ingenuity that our continent is endowed with. And I'm convinced a lot of innovators are working around the clock to come up with these innovations that are contextually relevant to our own challenges, especially on the continent. So yes, WHO is working together with many innovations to making sure that their innovations receive visibility that they deserve, because they are working so hard too, and they deserve that. So coming to address the issue of the kind of obstacles that we are facing, yes, that's why WHO actually decided to venture into this space, because one, we realized the opportunity that lies with emerging innovations, and at the same time appreciating some of the obstacles that WHO can help unlock, especially with the fact that we interface with government and we do have some kind of influence in that regard. So number one, what we have noticed, and the trend is quite changing as well, has been the culture of innovation on the region. Culture of innovation, one even from our own leaders, they are not really appreciated in as much as they know theoretically what innovation has done to other regions, but we don't see the kind of energy and effort being channeled towards stimulating the demand for innovation, especially from the African region.
But how can we do it? How can we make it more relevant?
So what we are also doing now as WHO is to kind of hold governments' hands to try and work and also encourage them to make some of the ecosystem space more accessible to our innovators. Case in point, we are helping to develop coherent policies that should facilitate development as well as scaling of innovations. We are also advising countries on what sort of infrastructure do they need to put in place to making sure that some of these innovations should actually emerge from those kind of platforms or infrastructure. We are also seeing a capacity gap. We are also rolling some kind of innovation management training tools so that to target our youth, and I've been actually in touch with UNESCO. We are designing a training module to help these youngsters in coding. As you know, that digital health is actually moving at a rapid pace. And we are also developing a module to target these policymakers on how to manage innovations and how to make innovation accessible to the continent. So we are working quite a lot in trying to identify what areas can we help governments with in facilitating this space.
So about to be able to identify and to be supported, Dr. Ola Brown, can you tell us, for example, in your country, in Nigeria, so you were able to innovate and to offer your innovations, but let's say if you want to do the same, for example, in Cameroon or in West Africa, do you think that the demand will be important, and how do you think that you can work with other African countries on such innovations, because the continent and all the regions need that?
So I'm going to make an initial point about relationships, and I haven't cleared this with the people that are running this webinar, but I just wanted to share my screen briefly, and I hope that this point is not too controversial. But these are the faces of people this year that have raised over $1 million in funding in Africa for Africa. Now, the reason why I showed their faces as opposed to their names is because most of them are not African.
Yeah.
I think that this speaks to the power of relationships, the power of networks, and the power of social capital. And these are things that a lot of Africans do not have access to. They might have the same kind of ideas as all of the faces in that picture, but they don't have access to the networks that can facilitate that. Because business only happens when people with ideas meet people with money. But the people with ideas in Africa are not meeting the people with money. And this is what this speaks to your point about scalability of these ideas. So I've been in business 10 years. Obviously, this is my primary business. I started off in the air ambulance business. So I built a multi-million-dollar business already, and that gave me access to networks. It gave me access to people that perhaps a lone innovator in Nigeria or anywhere else in West Africa would not have. So I think that one of the main issues for sort of scalability for myself still, and for other innovators around the continent, is that access to networks, both their own networks, so the policymakers and the government officials in their own countries, but also the development finance organizations, also the large global NGOs. They don't have those networks. They didn't go to Harvard or Yale or Stanford or any of these schools where you're going to meet those people that eventually work for those organizations. They went to University of Ilorin or some polytechnic around the corner, and they don't develop those relationships as easily. And I think that that's a major sort of bottleneck when it comes to scaling innovation on the continent.
But do you think also, for example, Mr. Bimpe, Israel Bimpe, do you think also that the banks on the continent are able to support and to invest in those innovations, and especially when we see how much creativity, how much engineers there are on the continent? Do you think that there is this culture of investment also needed from the bank?
I think it's really hard to attribute it to the banks only, right?
It's an example, because we said from the government, but you need banks also to follow you in your innovation.
I think you don't, my understanding is that you need an ecosystem, right? Zipline is a Silicon Valley-based company, right? It's from California, and what allows companies there to thrive is the ecosystem, and the ecosystem is made up of engineers who are capable to write software, engineers who can make something that can fly, a robot. You have people who can do business development, and you have different types of skill set, and you have venture capital, you have seed investors, you have, it's a whole ecosystem of different people that are investing in allowing a company to thrive on its solution, but also to be able to get the capital and investment to be able to thrive. And when the company like us come here and launch in Rwanda, one of the things that we are contributing to, and one of the things that allow us to be successful is there an ecosystem? Can the company come and hire an Israel who is Rwandan and not bring someone from San Francisco to work there? Can they find 15, 20 of us who can be able to really do that and drive it forward?
I think we have a problem with the connection. I would like to ask you a last question to all of you. I'm really sorry, but there is so much to say, but the time is a little bit short. About the recent initiatives on the continent, what do you think is missing to face this pandemic and other pandemics to come? What innovators like you, and it will be a call for other innovators, what is missing? What can we do more? Dr. Brown, can you hear me?
Yes, yes. So in closing comments, I'd like to quote a very wise man. I wrote his quote in one of my articles, and I'm going to say it again here. He said that development is what happens in Asia, but Africa is where development professionals come and ply their trade. I think that when we talk about development, real development, it always has to do with capital. It always has to do with investment. It always has to do with, it's not solely about poverty alleviation, but it's also about wealth creation. And unless our innovators are able to get wealthy off of their innovations and grow wealth and then go on to invest in other innovations, and that ecosystem approach that you spoke about, so important. So 10 years ago, I started my company. I became a multimillionaire and I started investing in other companies. Now I have 12 companies that I've invested in over time. Those 12 companies, somebody called me from one of those companies. They're now making another investment in a smaller company. And that's how economies are developed, right? Because somebody that I invested in is now doing the seed round for somebody else. So that's how capital pays itself forward. And unless we have more of these stories, more capital flows into the continent, more aims at wealth creation, not just poverty alleviation, and more real development, which requires capital. I think that that's a missing point. Development must be about capital. It must be about investment. It must be about building businesses. It must be about wealth creation. And I think that that has always been the missing link when we have these conversations in Africa. We're just talking about how to do water for people, how to give out free sanitary towels, how to give out free this, but we're not talking about raising them from that level to the levels where they can also become investors, and where the people that they invested in can also become reinvestors. And then the ecosystem is formed that way.
Yeah, can I just just to build on to what Dr. Ola Brown has just said, which I totally agree with. I also see it in chicken and egg kind of. So if you ask an investor, somebody with money, to say, why are you not investing in Africa, especially to support innovators? They will probably tell you that the cost of doing business in Africa is probably high and it's quite risky. And there is no guarantee that this thing is going to work. There are so many parts. But if we kind of drill a little bit down to say, what are those nuances that this investor is seeing? Probably one of the things that she's seeing is seeing a fragmented ecosystem, if there is any ecosystem to talk about. So, so that's why I was saying, in as much as we have identified funding as a major gap, but what I've also said is value, money follows value. So for as long as our ecosystem has been shaped in such a way that it attracts that kind of investment to take shape or to take place on our continent, we're not going to go anywhere. For me, in as much as I challenge, I'm pretty much convinced that we do have the talent on the continent. The ideas are there. We do have experts, engineers, computer scientists. I've seen that a lot, especially from our continent, having been in this space for quite a while. The only issue is how do we make innovation agenda is a top priority, especially among our people. And there is evidence. There are so many publications to point towards that. If we prioritize innovation, especially the homegrown innovations, there are high chances of them being sustainable because they are produced or they are developed in the context of their own challenges. So, yes, I think we definitely need to find a way of making sure that we conscientize our policymakers. We conscientize them to create that either incentive framework, be it fiscal or non-fiscal, to making sure that there is that space that these innovators can actually flourish. So I do believe that with that in mind, funding, either support or even market, all these things will naturally fall into place for as long as you have that ecosystem, which I take it as a football pitch. You can, Ronaldo can actually exhibit his skills for as long as that pitch is level, for as long that that pitch is well maintained. Otherwise, if he is to play his soccer in a maize field somewhere, we would not see him really like displaying his skills. So I just think that we definitely need to go on to the basics and fix what we need to fix, so that that ground can actually now encourage emergence of those innovations on our continent.
Thanks a lot, Dr. Chibi. And maybe the last word to you, Mr. Bimpe, on this case question before we close the floor.
No, I think we both said everything I could have said. You know, it's all about giving it the time that it needs to be able to grow and scale. And really, I like what Dr. Chibi said, you know, money, value, and capital follows really the value and the skills that is being there. Our first prototype shouldn't be what goes to market. You know, it has to be a product that is able to show real value to the end user and as much as possible. And you know, from a perspective of someone who works for a foreign company in the African continent, I think we have to also really reap all the form of benefits that we can when, you know, there is a foreign direct investment on the continent, use it to kind of reinforce that ecosystem and use it to benefit, bring new skills, new type of opportunities for the youth of Africa, and to be able to work at the next frontier of innovation, you know, drone technology, AI, robotics, and so on and so forth. This is what's next. And we shouldn't, you know, always have 10 years of backlog as we go, and be able to really leapfrog as much as possible. So that's what I had in mind.
Thank you. Thank you, everybody. We reached the end of the session. So thanks a lot for your comments and contribution.
Take care.
Okay.
Perfect. Thanks. Take care.